Hello, good morning, friends. This is M. Nizaruddin, consultant orthopedic physiotherapist in Shifa Physiotherapy Clinic, Gobichetipalayam. And today we will be discussing about low back pain because it comes to about 60% of the total cases I get to treat in my clinic. And also because this is the second most common pain type of pain that we are after headache. Today I'll be trying to share some of the as much information as possible about low back pain by keeping my words simple and understandable, but some words and terminologies may pop up here and there, but I'm sure that you guys can get hold of it. About low back pain is a symptom rather than a disease in itself, which occurs to everyone once in their lifetime, at least once in their lifetime. But having said that, there are some risk loops. People who are most susceptible and more prone for low back pain are the risk groups. For example, or lung cancer, the main risk groups that will pop up in your mind is smokers. The risk groups who are more susceptible for getting low back pain are obese patients and who are all tall individuals. Women are more prone to get low back pain than men because of their early osteoporosis. Then comes the people who adopt bad posture for prolonged amount of time, people who have poor abdominal muscles, and people who have got psychological conditions such as hysteria, depression. All these factors causes the low back pain. What diseases causes low back pain? As I have told you, low back pain is a symptom rather than a disease in itself. So it is followed by an underlying disease. Diseases which causes a low back pain are broadly categorized into categories, and I'm not going to speak everything in detail. I'll certainly touch one of them now. For the first category that causes low back pain is a degenerative category. So first of all, the term degenerative means a deterioration of the normal structure which results in a decline of a function. For example, when you take provide bone which provides stability, when it gets destructed or deteriorated, it will show a decline in its functionality. The diseases which comes into this category are osteoporosis osteoarthritis, the deterioration of the facet joints, or the degenerative conditions which happens in the disc will result in a decline in the functionality. Then the next category is the inflammatory category. The ankylosing spondylitis, the rheumatoid arthritis, which causes the inflammation in the structure of the joints of the spine. The next category will be infectious category, which causes infection to the spine. It may be pyogenic vertebral spondylitis or maybe epidural abscess, tuberculosis of spine. Now the next category is the metabolic category. Before we move on to the metabolic, we need to look into what is metabolism. Metabolic is a chemical change that happens to maintain the body in a healthy manner. If any hindrance or any disturbance, it will result in a disruption of the total entire metabolism. For example, in osteoporosis, the calcium metabolism is getting disturbed, so that will lead on to weakening of the bone, and it will result in low back pain. Basically the calcium formation is getting disturbed in osteoporosis. Then comes the next category, is a neoplastic category. Neoplasm in the sense an abnormal growth or abnormal growth formation. It can be benign or it can be malignant. A tumor, for example, it can be benign or it can be malignant. It will result in low back pain. Then the next category is a traumatic category, which can be easily understood. Any fracture or any dislocation in the spine causes low back pain. Then the next category is the developmental category or a congenital category, which can happen in the childbirth or it can happen in the developmental ages of the child. For example, scoliosis. It is an abnormal S-shaped curvature, so which develops in the developmental years of life, or it can be congenital. When you look into a person from a person from his backside, you could able to say that person is having an abnormal S-shaped curvature. Then the next category is a musculoskeletal category. There is an abnormal muscular tension followed by a bad posture or adopting a bad posture for a prolonged time. So this will fall into the musculoskeletal category. Another category is the viscerogenic category. Basically, it relates to viscera. It is also called as renal calculi or any genitourinary tract disturbance or infection will result in low back pain. The other terminologies, it is called as an referred pain, because the problem may actually not being in the low back, but it can get referred from somewhere around the low back, and it is being referred to the particular low back region. The next category is the vascular category. Vascular means arteries and the veins. The diseases which comes into that category is abnormal aortic aneurysm. So this is actually a fancy terminology, which it means that there is a blockage on the main artery which supplies the abdominal contents, which results in low back pain. Now we understood what is low back pain and who are all at the risk of getting it. In general, the classification of low back pain according to the disease conditions. In the next lecture, we will see about the assessment and also the treatment the low back pain. So I thank you for your patient listening. Please do write on my Facebook page and subscribe to my YouTube channel. Thank you.